Hi, I'm Karen Van Caulil, the President and CEO of the Florida Alliance for Healthcare Value. The Florida Alliance is a 501c3 nonprofit research and education organization. We're Florida's business coalition on health. We've been in existence since 1984 and have always been led by Florida's top public and private sector employers. Our members are largely self-funded employers, which means that they pay all the bills for their plan members' health care, and they have a lot to say in what their health plan benefit design looks like, how care is delivered, where, and how it's paid. Some employers have been playing a proactive role in reducing unnecessary C-sections and promoting high-value maternity care through various approaches I'll share with you. But first, let me tell you why employers care about C-section rates. On average, a C-section delivery costs about $10,000 more than a normal vaginal delivery. Maternity is one of their biggest expenditures, and now, more than ever, our employer members need to extract the most value out of every dollar they spend on healthcare. For most of them, maternity is the second largest medical expenditure. And that doesn't even account for costs associated with reduced productivity, absenteeism, or short and long-term disability. In fact, pregnancy is a leading cost of disability for most companies. We've seen C-section rates double in Florida in the last several years. In 2019, 45% of the births paid for by Florida employers were C-sections. That's almost double the Healthy People 2020 goal of 23.9% or less. This rate varies significantly by hospital, and we know that the facility from which a mother elects to receive care for any stage of pregnancy and delivery can significantly impact cost and quality outcomes. Appropriate facility selection isn't even possible without the availability and transparency of cost and quality data. So that's critical for us at the Florida Alliance, since our employers are at risk for every healthcare dollar that's spent for their plan members. So what are we doing about it? Together with our employer members, we meet with hospitals to share our data. That includes claims data and very detailed data from the Leapfrog Hospital Survey. We have access to the Leapfrog data because we're the regional leaders for Florida for Leapfrog. In these meetings, we express concerns over high costs and mediocre outcomes and specifically talk about C-section rates that are above target. The employers make it known in these meetings that if there is improvement to be made in maternity outcomes, that the hospitals the employees deliver at must join the Florida Perinatal Quality Collaborative and participate in all of their programs, including PROVIDE, the initiative geared to promoting vaginal births. At these meetings and the follow-on meetings that occur, we discuss how we can collaborate in quality improvement initiatives. We know that the employer plays a very important role in solving this problem through employee education and enhanced health coverage. Some employers have been paying a blended case rate that reimburses hospitals and physicians the same amount whether a mother delivers vaginally or by C-section, removing any financial incentives that could affect how the provider delivers care. We have moved, though, more recently to a more comprehensive episode-based bundle that reimburses one payment to the providers for all prenatal, birth, and postpartum services. We have identified other high-value strategies. We know that midwives do a great job providing prenatal and birth care for low-risk pregnancies and are associated with improved outcomes, lower costs, and higher patient satisfaction. We recommend that the plan adequately covers and reimburses for midwife services and care provided at accredited birth centers. Birth assistance can also improve outcomes, increase patient satisfaction, and decrease unwarranted medical intervention. We suggest to the employers that they reimburse plan members for part or all costs of a birth assistant. Empowering pregnant women with the information they need to make the right care choices is another effective strategy. Providing employees with information and incentives to seek care from high-performing providers by utilizing tiered or a narrow network, linking to hospital C-section rates and online provider directories, implementing reference-based pricing, and distributing patient education and engagement materials and tools are all really effective strategies in improving maternal and birth outcomes. This is a schematic of an episode of Care Maternity Bundle. It's a work in progress. Our goal is for all healthcare purchasers to standardize what comprehensive high-value maternity care encompasses, from the diagnosis of pregnancy through to at least 2 months postpartum. Because 60% of Florida births are paid for by Medicaid, we've been engaged in discussions with ACA leadership to define a single bundle for maternity care, linking provider performance incentives for prenatal care, labor and birth, and postpartum care, including the newborn. This creates an integrated continuum of care that delivers better outcomes at a lower cost. At each stage of the bundle, the episode is designed to be effective in improving care and quality. It's structured to influence key maternity care factors, including appropriate prenatal care, facility selection, and C-section rates, particularly in low-risk pregnancies. As I said, the bundle's a work in progress. We're considering the addition of LARC, long-acting reversible contraception, and SBIRT, screening, brief intervention, and referral to treatment, onto the front end of the bundle, and incorporate all aspects of the Florida Perinatal Quality Collaborative's maternal opioid recovery effort. We look forward to continuing to work with providers, researchers, advocates, the state, and public and private payers to standardize the bundle's components and the quality gates, because we feel that providers will be much more amenable to operationalizing a maternity bundle if most, if not all, of the pregnancies and deliveries in their practice are defined in the same way, with the same quality measures and expectations of quality. Thank you, and we look forward to working with you.